Naloxone is used for the emergency treatment of known or suspected opioid overdose. Symptoms of opioid overdose may include unusual sleepiness, difficulty waking up, or breathing problems. Other symptoms may include very small, pinpoint, pupils, slow heartbeat, or low blood pressure. If someone has serious overdose symptoms but you are not sure if the symptoms are due to opioid overdose, give naloxone right away anyway. Since symptoms of opioid overdose may return after treatment, be sure to get medical help right away after giving the first dose of naloxone. Naloxone works by blocking the effects of the opioid in the brain. When using Zimhi 5 mg per 0.5 ml injection syringe opioid antagonists, it is important to follow the instructions provided by your healthcare professional or the product package. This medication can be given as an injection into a muscle, under the skin, or into a vein by a healthcare professional. Before using Zimhi, it is crucial to check the product visually for any particles or discoloration. If you notice either of these, do not use the liquid. It is also important to learn how to store and discard medical supplies safely. It's important for close family and household members to know the symptoms of an opioid overdose and be instructed on how to give naloxone if needed. This medication should be used to treat an opioid overdose right away to prevent serious effects such as brain damage. The dosage of Zimhi is determined based on your medical condition and response to treatment. The effects of this medication are rapid but not long-lasting. If symptoms return after giving an injection, another naloxone injection can be given every 2 to 3 minutes. It is important to continue to closely watch the person until emergency help is received and to inform the healthcare professional that naloxone has been administered. Your doctor prescribed Zimhi 5 mg per 0.5 ml injection syringe opioid antagonists because they believe that the benefits outweigh the risk of side effects. Most people using this medication do not experience serious side effects. If you have been regularly using opioids, you may experience sudden withdrawal symptoms after receiving this medication. These symptoms can include body aches, fever, sweating, watering eyes, runny nose, sneezing, goosebumps, weakness, shivering/trembling, nervousness, restlessness, diarrhea, nausea/vomiting, stomach cramps, increased blood pressure, and a fast heartbeat. In babies younger than 4 weeks who have been regularly receiving opioids, sudden withdrawal may be life-threatening if not treated properly. Symptoms in babies may include seizures, excessive crying, and muscle twitching/spasms. A serious allergic reaction to this medication is rare, but seek medical help immediately if you experience symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects. If you notice any other effects, make sure to contact your doctor or pharmacist. If you're in the US, you can call your doctor for medical advice about side effects, or report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report side effects to Health Canada at 1-866-234-2345. Before using Zimhi, make sure to inform your doctor of any allergies you may have, as this product may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history, especially if you have any heart problems. If you are pregnant, it's important to use this medication to prevent harm to you and your unborn baby from untreated opioid overdose, but it's important to talk to your doctor about any potential risks. It's also important to consult your doctor before breastfeeding while using this medication. When taking Zimhi 5 mg per 0.5 ml injection syringe opioid antagonists, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of side effects. It's essential to keep a list of all the medications and herbal products you are using and share it with your doctor and pharmacist. They will be able to advise you on any potential interactions and help you to avoid any negative effects. Remember not to start, stop, or change the dosage of any medicines without consulting your doctor first. This will ensure that you are taking the medication safely and effectively. If someone who doesn't regularly take opioids overdoses on Zimhi, it's very unlikely. But if they do, and they experience severe symptoms like passing out or difficulty breathing, it's important to call for emergency help right away. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. Be sure to consult with your doctor or pharmacist on how to avoid opioid overdose. It's also important to educate your family members on the signs of an opioid overdose and let them know where you store this medication. Zimhi is an opioid antagonist indicated for the treatment of known or suspected opioid overdose, as manifested by respiratory and/or central nervous system depression. It is intended for immediate administration as emergency therapy in settings where opioids are available for use. Zimhi is available as a 5 mg per 0.5 ml injection for intramuscular or subcutaneous use. The recommended dosage of Zimhi is 0.4 mg to 2 mg administered intramuscularly or subcutaneously. It is important to note that Zimhi should be given as soon as possible after an overdose, and it may be repeated at 2 to 3 minute intervals if there is no response or if symptoms return. It's important to store Zimhi 5 mg per 0.5 ml injection syringe opioid antagonists at room temperature, away from light and moisture. Remember not to store it in the bathroom, and always keep it out of reach of children and pets. When it comes to disposal, never flush medications down the toilet or pour them into a drain unless specifically instructed to do so. Make sure to properly discard this product and it is expired or no longer needed. If you're unsure about the best way to dispose of it, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.